and I went and worked at a synagogue in Kansas City, and I hated every minute of it, and I decided that that was not the path for me. So then I moved to Philadelphia, where one of my friends from New College was going to grad school, and I started working as a professional cook, and then from there became a personal chef. And then at that point, I started looking for jobs that were a little more intellectually fulfilling. And I realized that everything that I thought sounded interesting required an MPH. So then I started looking at MPH programs and applied to a few different options around the country and ended up at Drexel. When I started at Drexel School of Public Health, I thought that I was going to go into community health, which is kind of working with the community to improve like individual and small group health outcomes. And the more I learned about what public health was, the more I realized that I was more interested in systemic change, in what we can do at the policy and state and national level to really improve health for everybody. So I ended up concentrating in health management and policy. While I was there, I worked with the city of Philadelphia to conduct a health needs assessment for the entire city, which was really fun and very cool. After that, I did a health communications fellowship at the National Cancer Institute. And this is where I kind of took a detour from public health and went into really intense science that I didn't understand, that I had to write about. I worked for the Cancer Genome Atlas, which is a major cancer genomics research project headed up by the National Cancer Institute. So I worked there for a year, and I learned basically how to write about anything because I didn't know anything about what I was writing, and I just had to learn. So from there, I decided that cancer genomics was not going to be my path in life. And I ended up at a Medicaid think tank. And that's where I was up until last month, which is I was at the Center for Healthcare Strategies, which is what you guys saw. I was working as a communications associate there, where I worked with their children's health and their the programs that worked with patients with the most complex needs. So that I don't get too jargony, I'll explain what that is first, and then we can go from there. Patients with complex needs is kind of the industry term that's being used now for individuals who have multiple chronic conditions. So that could be diabetes, hypertension, COPD, like all of the kind of like major chronic health conditions that we think of. And then they generally also will have some kind of behavioral health condition or conditions as well. So that's mental health, so things like schizophrenia, major depressive disorder, bipolar disorder, things like that. But it also includes substance use disorders. So these are individuals who have a lot of need and who are the most failed by our system. So through my work at the Center for Healthcare Strategies, I realized that that was an area that I thought I could do a lot of good and that I could really use my skills in the most effective way. So now I'm at the Camden Coalition of Healthcare Providers, and I just started last month, so I can kind of talk about what I do there, but I'm still figuring it out. So I work with the data team there to help them publish on what they've been finding. So they've been doing tons of research for the last 15 years, and they've published 3 articles. And they are tired of not having published, and so they brought me on to help push them through and provide writing support. So helping people who've been doing this research get their words out on paper and in a coherent way that somebody else can understand, and then also producing content myself. So actually writing pieces as well. So that's kind of my long, short version of the last almost 10 years of my life.
Oh, thank you.
So I know it's a lot, so we can start wherever you want.
So you can throw out questions or I can take raised hands either way.
So Teagan, why did you go into public health?
So it was really as simple as I quit my job cooking, and I was really, really burnt out. It's a really hard industry to work in. And I was looking for jobs, and everything that I thought was interesting and everything that I thought I could do all required MPH. I didn't really know what public health was, I would say, even until I got to school. Like, I think I just kind of did, and I wouldn't recommend that as a strategy. But I think I didn't really, I understood what I wanted to do, and that what I wanted to do was public health, but I didn't understand like what public health is as a whole. Because it's a lot more complicated than just going into the community and helping them help themselves and things like that. There's a lot of facets to it. So it's really just, I think, the other piece that I kind of realized over time was that when I was at New College and when I was doing all this work in religion, one of the things I was most interested in was the intersection of religion and health. So I was really interested. I did some work, I can't remember like what exactly I did, on specifically on like evangelicals who were really interested in, or who like focused on health and healing. So like my thesis was about a televangelist who was really into healing and did a lot of laying on of hands and things like that. And so I realized that I've actually had this interest for a long time, but I knew I wasn't going to be a doctor. I knew I wasn't going to be a nurse. Like, that was not going to be my route. And it just took me a while to figure it out, I think. Are you guys all interested in public health and health professions and things like that?
Yes.
Okay. So you guys know what public health is more than I did when I started my very expensive grad school program.
Well, that's a good question. Does anybody want her to define it? There is a hand. It was a couple hands. Could you give a brief summary?
Sure. So public health, I can't give you the textbook definition, but the way that I explain it to myself and other people is that public health is just institutionalized social justice work that has somewhat of a focus on health. So we've basically come to realize that health is not just your medical conditions or having a lack of medical conditions, that health is the environment that you live in. The jargony term for it is the social determinants of health, or the social correlates of health. So those are things like where you live, your education level, your race, your ethnicity, your native tongue, I've never used that phrase in my life, your native language, excuse me. It's all of these other factors that can influence both your ability to access healthcare and your social opportunities. So if you have a lot of language barriers, or you live in an area like Philadelphia where the school system is absolutely terrible, your overall health outcomes are going to be not as great as if you grew up in some like ritzy suburb outside of Philadelphia. So public health is looking at all of those pieces and how they work together and trying to solve the problems piece by piece. So that way we can create the systemic change that we need to help everybody have the opportunity to live a healthier life. So if you're really into social justice, public health is a great option. If you're interested in equity, if you're interested in changing the system from, kind of a pragmatic point of view, it's a really great field to explore more.
I was wondering if there was something in particular that attracted you to Drexel's program, or also like what other programs maybe you looked into when you were applying to grad school.
So the thing that attracted me to Drexel was that they gave me almost half off my tuition in a scholarship. I'm not sure how much you guys have looked into grad school yet, but master's programs at least generally don't give a lot of money, and they're extremely expensive. When I was at Drexel, it was $33,000 a year for tuition only. And I think now they're up to 36 or something like that. So Drexel gives out money, and the other schools I got into didn't. And I lived in Philadelphia, and so it was easier to stay than it was to move. But I also looked at University of Illinois in Chicago and NYU, and they were about comparable in tuition, but they didn't offer anybody any scholarships. So I tried to be as practical about it as I could. I couldn't imagine moving to Manhattan, paying over $30,000 a year in tuition, and then trying to live in Manhattan as well.
If you were like in our position at New College again, what kind of courses or work would you do right now if you knew that you were going to end up in public health?
That's a really good question. So I know that a lot at New College has changed since I was there. I think you guys have much more of a focus on STEM in general and career planning. When I was there, it was kind of just like hey, we're a liberal arts school. It was before the recession, so everyone was like, oh, you'll be fine, you'll get a job, everything's okay. And then I graduated, and then the economy collapsed, and so you guys are hopefully benefiting from some of that lack of structure that we had when I was there. So I don't really know what options you have now, but with what I know about what was available when I was there, I think I would probably take statistics because you're going to take biostatistics and epidemiology at least in an MPH program. And if you end up going the epidemiology route, you're going to need a lot more math. It's not math like pure mathematics, like it's not calculus type stuff, but it's all stats. So I would definitely take that and get some background in that. And then I would try to do kind of a well-rounded social sciences curriculum. Do a good job in psychology. If you have anything available to you about addiction, learning about what addiction is and how it works and why it's so difficult to break the cycle and things like that, because addiction is a huge public health issue and a huge influencer on people's overall wellness. And then I would try to get as much content knowledge as I could about kind of, if you want to stick with the US system, kind of like American, like American social systems and like how we ended up where we are now. And if you're interested in a more global view of public health, then looking more at like colonialism, like that'll help you a ton if you want to go work in an African country, if you want to work in a South American country, like understanding that kind of stuff would be really helpful context. It's not going to necessarily feed in directly to your classes in public health, but it'll give you a framework of understanding why the issues exist that a lot of your colleagues in grad school wouldn't have. And the other thing I would say is really work on your writing skills. Writing is a huge part of public health. No matter what you're doing, you're going to have to communicate it to other people. And two, I would say that the thing that I really appreciated most about my New College education when I was in grad school was that I wasn't there to make good grades. Every other person I was in my program with was obsessed with getting A's, and I truly didn't care. I'd been so spoiled at New College, and I spent all of my time either trying to really learn the material because I really, really cared about it, or figuring out how much work I needed to do to pass the class. And I did super well. Like, it's not like I was, failing out of classes or anything, but, the kind of like the balance that you learn how to strike at New College of like, some classes take more effort, some classes take less effort. And I was able to do that. So really honing that skill rather than doing what a lot of my colleagues did, which was go all out in every class, and they were burnt out by the first year. And I was like, whatever, second year, I'm fine. I'm not tired yet. So really take advantage of the balance that you are learning how to have with your workload.
You know, Teagan, a number of the things you said reminded me somewhat of social work, just in the course preparation. Would you like to talk about similarities and differences between public health and social work?
So I can't really speak to what social work is as a field. I kind of know how social workers interact with a lot of public health programs, so I can kind of speak to that. Social work is one of, if not the biggest partners of people who are doing public health work. Because social workers navigate the social services system, any program that's trying to help people get on Medicaid, get Social Security, get on disability, you know, any program that's doing that is going to engage social workers. So there's a lot of overlap there. I think that social work is generally, you know, as a whole, certainly not individuals, everybody kind of does their own thing, but social work is kind of focused on like case management and specific clients, whereas public health is looking at a population. So it's looking at like, what can we do for this group of people, you know, men aged 18 to 25 who live in a 10-block radius, who have gone to the emergency department 3 times in the last 6 months. Like, what can we do for that population of people, rather than having like a bunch of clients that you are working with individually to solve each of their individual needs. So I think that's probably the biggest difference, but there's definitely a lot of overlap, and a lot of the two sectors really work together a lot.
But that's a great distinction. One's working with the whole population and one's trying to make a difference with individuals. Right. Yeah.
Right, and they're both really important. Public health can't exist without social workers. It's really, I think, a matter of the difference in focus. And people who work in public health also work with individuals as well. Just the kind of the framework that they're approaching that work with is a population level.
As far as opportunities in Philadelphia, are there a lot of public health career openings for someone who's about to graduate?
Like undergrad or grad school?
Undergrad.
Probably. There's a lot of job opportunities in Philadelphia, period. Like all sectors. It is one of the few major cities that's actually growing in population, and growing in, I believe, like the under 35 population. And that's because of jobs. So as you're looking for jobs, look in Philly. It's also like a pretty inexpensive city to live in. So it's got that going for it too. There are, I want to say, 5 major hospitals in the city. There's also many universities that are all doing health research, and lots and lots and lots of nonprofits. Philadelphia is a very poor city. There's a lot of poverty, and the wealth disparity in Philadelphia is astonishing. And as such, the life expectancy disparities are huge. The educational disparities are huge. Everything that you can imagine that is tied to poverty, we've got that disparity worse than you want to admit it. So certainly in the nonprofit sector, there's lots and lots of jobs. There's also in Philadelphia a lot of AmeriCorps Vista volunteers. So if you're interested in looking into that, I think they bring a lot of people into Philly.
Tia, would you like to just speak to some of the career paths that a person might have with an MPH, just sort of categorically? I do this, do this, do this.
Sure. So there's 5 main branches of public health, and you kind of get this from if you're looking at public health grad schools, you'll see that there's 5 core courses that everybody has to take. So there's community health, which is doing specific interventions, which is like programs and projects that are trying to make a specific change within a population. So there's the community health side. That's often where you'll get like the kind of on the ground, nonprofit, community-based organization work. Then there's health policy, and management gets lumped in there, but they're really different. So health policy is looking at the policies at the state, local, federal policies that are in place, how they get implemented, what happens once they're implemented, and what kind of changes we need to make things better. So that's where you get into Medicaid, Medicare, all your health insurance stuff, all of the Affordable Care Act stuff that's going on now, that's all health policy. Health policy is, I don't know if I can definitely say that it is probably the easiest, not easiest, but it is the sector of public health that certainly has the most growth potential for jobs, because of, well, it was originally because of the Affordable Care Act, but now because of whatever's going to happen with the new administration, we're going to need a lot of health policy analysts to get in there and help states figure out what they're doing and how they're going to be able to serve their constituents. There's also health management, which is basically like running hospitals and running clinics, so the administrative side. So if you're interested in the business side of health, kind of health management would be the direction you'd go. There's also environmental and occupational health, which again is kind of mushed together, but is really different from one another. Environmental health is generally really, again, very justice oriented. So looking at the ways that, in the simplest form, like things like pollution disproportionately impact people of color and people living in poverty, and what we can do to both prevent that in the future and mitigate what we have now. So that's where you get, people who are working to change, I don't know, nuclear sites. Actually, the Dakota Access Pipeline is an excellent example of environmental justice. So through public health, you can get, a very, a very like scientifically based understanding of why that shouldn't happen or whether it should happen, and what can be done to either help mitigate any long-term effects if and when the pipeline is built, or the opportunities for avoiding that. So, if you went into environmental health, maybe you would work for the Army Corps of Engineers. I don't know. Like, you could go that route, or you could go a different route. It's pretty varied. Kind of similarly, occupational health is looking at the workplace and ensuring that people are safe when they work. So that's everything from like, your kind of traditional thinking, like, is a factory safe for people to work in? Are there particulates in the air that if they breathe them in, they're going to get sick? So like asbestos is a great example of that. To things like, are restaurant workers wearing non-slip shoes? Are they washing their hands? Are they handling food correctly? All of those kind of the things that happen at work that keep the employees safe and that keep any of their consumers safe as well. And then finally, I think the last branch is kind of the epidemiology biostatistics branch, which I'll be honest, I know the least about. Epidemiology is the study of how diseases spread throughout populations. So that's everything from infectious disease like HIV, hepatitis C, Ebola, the flu, like all of that stuff, to the way that chronic disease changes in a population over time. So this is a cat is trying to get involved. So looking at chronic disease, so something like asthma, looking at rates of asthma in different populations over different time periods, looking at, if ozone levels are higher in the summer, what does that do to rates of asthma hospitalizations, things like that. And then biostatistics is really the one I know the least about. That's something mathy that you're better off looking up yourself. I don't want to give you the wrong information. So those are all kind of like the major streams of public health. And then within that, like everybody kind of goes a different route. One of my friends who was an epidemiology student now works at the Children's Hospital of Pennsylvania on their transplant team. And she works with the physicians there so their ultimate goal is to improve post-transplant outcomes. So kids who get a transplant, how good is their health, 30 days later, 60 days later, 90 days later, whatever the intervals are. But what that means in practicality is that she goes around with the doctors and she listens to what they are talking to their patients about and make sure that the electronic health records that they're using to take notes in are really reflective of what information the doctors are asking. And then she crunches all these numbers and figures all this stuff out, and she can tell, when physicians ask this set of questions, the outcomes are, they've changed by 10% or something like that. So she's able to look at, all of that data and see what physicians should be doing differently in practice that might help their patients get better faster. Another friend of mine who went the community health route just got back from a Fulbright in Uganda, where she was working with middle and high school aged girls about, I still don't entirely know like all of the details, but it was something about menstruation and keeping girls in school and talking to girls about what the cultural barriers were for them and talking to these young women about what they needed to be able to stay in school, like what they wanted and what they thought would actually be practical and useful. Because it's not any good for an American to just come in and tell somebody what to do. It never works. So she came in, excuse me, she came in and talked to these young women and helped them develop the resources that they needed to be able to stay in school. So it's like huge. It's such a wide breadth of options. And then you have me who's like working here in the United States on a research team as a writer, and we all have the same degree. So it's really, really varied.
Would you say it's a really versatile degree then?
Yeah, it's a very versatile degree. I think it's a great degree for people who know that they're interested in health, people who don't want to be clinicians, or who might want to be clinicians but aren't quite ready to make that commitment yet. Or people who want to be clinicians but know that the education that's required is not for them. Like I could look at med school and tell you there was no way that I was ever going to make it through. I was never going to get in. So it's certainly appealing in a lot of different ways. And then it's great for people who just know that they're interested but don't know exactly how. They know they want to do something. My friend who works on the transplant team came in because she started the MPH because she'd applied to dental school for 3 years in a row and didn't get in. And she's like, well, I have to do something. I'm just going to go get an MPH. Maybe that'll make me a better dental school candidate. She came in saying, I only want to do work in oral health, not interested in anything else. Now she's working on a transplant team at a children's hospital. She also doesn't like children. It's just... It's really when you come in, you think you want to do one thing, and by the time you leave, you've learned so much about what's available to you that you can end up doing something entirely different. So yeah, it's super versatile, and it's a great kind of, it's not a general degree, I wouldn't say that, but it is certainly a degree that gives you more options than, it's probably more similar to something like an MBA, where like everybody who comes in to an MBA program wants to get something different out of it. I think it's more similar to that kind of degree program than something like a PhD in history. You go in for a PhD in history, you kind of know what you're going to get out of it. You're going to be a historian, you're going to have a doctorate, you're going to go into academia. It's pretty much the career path you're choosing. With an MPH, you come in and you could be doing something that you weren't expecting by the time you're done.
At Drexel, did you ever take any course, or did they offer any course in maternal child health, or did you experience that at your recent job?
Maternal child health is a huge part of public health in general. When I was at Drexel, there were classes in maternal child health. I didn't take them because I was focused on health policy and I just didn't have enough room in my schedule. But definitely there's a real push for that kind of like preconception, prenatal, and the immediate postnatal health, that focusing on that time period and the first 1,000 days of a child's life, like kind of that whole spectrum of time, is definitely a big thing in public health in general. And I believe something that Drexel is starting to focus a lot more on. Is that a particular area of interest for you?
Yeah, that it's either that and health policy.
Mm-hmm.
So the merge between the two would be perfect, but not everywhere. It's like New College where you can create your own. So.
Yeah. Almost nowhere is like New College.
Right.
I do think that Drexel, and I don't want to push Drexel too hard. Like, I don't think it was a perfect program, especially coming from New College. I was like, this is not difficult. Like, I was kind of disappointed in the academic rigor. And I would probably say prepare yourself for that in most master's programs. Very little is as rigorous at the master's level is as rigorous as New College's. But at Drexel, there is a lot of focus on community health and children's health in general. And then the health policy department is, I would say, their strongest department. So if you're interested in an MPH and focusing on those areas, definitely look into Drexel for sure. Also, like I said, they give scholarship money. Yeah. So you just have to send them the whole stack of all of your evaluations and explain to them why you don't have a GPA, and they'll still give you money. Yeah.
Teagan, do you need to know which of those 5 subspecialties you're interested in to pick a grad school? Do the different MPH programs emphasize one over the other, or how important is that?
So I think some of the schools emphasize it more than others. I think for all of them, you have to write an essay where you talk about what you want to do. And a place like Drexel won't hold you to that. I'm thinking back to NYU. And NYU had 3 very specific tracks that you had to stick to. So you were accepted to a particular track, and I was accepted to like the nutrition track or something because I thought I wanted to do like a food security route with my life. So I think for a school like NYU, and there are probably other schools like that, that are pretty structured with their admissions process, you would need to know and feel really confident that that was what you actually wanted to do. But most schools, I think, are fairly broad, where you just come in and you say, like, this is what I think I want to do. And they'll say, great, you sound like a good fit. And then you take, 1 semester of classes and you realize, I don't want to do that. And then you change your mind, and it's no big deal. But it is good to come in with some kind of focus, at least so you just know like where to look first, because you're going to have a lot of options. Yeah.
What jobs were you looking at that you needed a master's in public health for?
That's a good question. So I was really looking at jobs in the nonprofit sector in West Philadelphia that were focusing on food security and hunger programs that were also kind of looking at both policy and individual behavior change. So it was like a very specific type of job that there were a lot of. And maybe they didn't require an MPH, maybe I'm just remembering it differently than it actually was. But I remember seeing MPH as one of the degrees that you should have to apply for this job. And I was like, well, I only have a bachelor's degree, so I'm not going to do this. Looking back, I should have applied for the jobs anyway, but I'm glad I did what I did. So yeah, it was kind of these very like community-based, like entrenched in the community type jobs, working with people to get access to food. So whether that's supplemental nutrition benefits, or, you know, learning how to grocery shop, or learning how to cook, or, you know, all of those kinds of things. They were looking for people with MPHs.
Can you comment on the difference between like the nonprofit sector and like government work, and what kind of opportunities exist in those two sectors? Are you familiar at all with?
So my only government experience is at the federal level as a fellow. So I didn't go through the hiring process. I would say that number one, the hiring process is one of the biggest differences. The federal hiring process is very difficult to get through. Just a lot of barriers to entry for those federal jobs. But it's worth it to get on USA Jobs, start getting the alerts now, because it could take a year, 18 months to get hired. But just, you know, get the alerts and just try it out. Nonprofits, you're not looking at nearly as strenuous a hiring process. So I think there's kind of there are two ways to look at it. One is that government work, either federal or state, local level, you're subject to a lot of budget changes. And particularly now, not to like keep talking about this, but like we have no clue what's going to happen.
Right.
We don't know what's going to get cut. We don't know if CDC is going to have enough funding. We don't know if NIH is going to have enough funding. However, the flip side of that is nonprofits also go through that, right? So you can also get a job at a nonprofit and, you know, you have a 2-year grant term on your, you know, you're hired for a 2-year grant. That grant's over. This just happened to my husband this summer. The grant was over. He was out of a job. Mm-hmm. So both, you know, all of these worlds are kind of in flux. I think for me, the nonprofit world has been, bless you.
Thank you. Thank you.
The nonprofit world has been a good fit for me. I think government, you know, we talk about government bureaucracy because it's real. And not that nonprofits don't have that, but a nonprofit is a small entity that exists within the context of a lot of larger entities, whereas the government is the big entity that has all of these people and all of these regulations that it has to follow. But at the same time, you can do a lot of really great work in government. You are potentially helping to write the policies. You are helping make laws go through. Like, that's a great option. And in nonprofits, you don't have that. You can you can work in an advocacy organization where you're trying to influence policymakers, but you're not a policymaker. So it's kind of, you know, two different but interrelated. Sorry, can you guys hear the music that's playing? No. Oh, there's a person who just parked outside my house with very loud music on. So it's, you know, two very different but interrelated sectors. The other thing to consider is that if you work for 10 years in nonprofits or in government, you can get the remainder of your student loans forgiven. It's the public service loan forgiveness program. It also works for your bachelor's degrees if you guys have undergrad loans too. I know I keep talking about money, but this is a really expensive education and it's like a medium paying field. It's not the worst paying field for sure, but it's also not like, you're not making like, you know, $100,000 a year right out of school. So the financial side of it is really important to consider, I think. So that loan forgiveness program is available to you, and you should take advantage of it for sure if you go into nonprofit or government.
Can you give some ballpark numbers in terms of?
I'm sorry, I can't really hear you. These people are being so loud outside my house.
Right. I'll come closer to the mic.
Okay, great.
Can you, I know there's a lot of jobs, but can you give some ballpark numbers in terms of those first jobs out of the MPH? What kind of money people would expect to be earning? Ballpark?
Okay, that's a good question. Let's see. So I can tell you what I made right out of school. I don't care. My fellowship, I made $33,000, which was exactly the same as 1 year's tuition at my grad school, which was very depressing. And then my first job after that, I made $51,000. So I wasn't dying, but I do live in a major city, and it wasn't like I didn't feel flush at all. And I would say that the range, and then I think about my friends who did epidemiology, I think, one of my friends who did epi was making like $68,000 right out of school. One of my friends who works for an insurance company makes over $70,000 now. So, it's a huge range. If you work at a community-based organization, doing direct service with people who really need it, you could be making $35,000. It's like the range is all over the place, and it really depends on where you want to focus. And, over time you do make more money. So like, these are just starting salaries the first couple of years, what you would be looking at. But yeah, you want to go work for an insurance company, you're going to make more money than if you work in a nonprofit like I do. It's just how it's going to go. They're a for-profit company. They exist to make money, so they're going to pay you more. But you have to be comfortable with working for a for-profit company, which some people are, some people aren't.
The question that I have, going back to the comment that you said earlier about having an MPH and having it being such a versatile degree, for someone who's not going to go straight into an MPH and a PhD, do you think that's limiting the options that you have? Because I'm not looking to go into an MPH program because of paying out of pocket. I want someone else to pay for my degree.
Yeah.
So,
yeah.
I just want to know can you comment on your perspective on how different that is to have a PhD, and if that degree can be also as versatile as an MPH?
Mm-hmm. So I can kind of speak to the doctoral level in public health, and then I can also speak to PhD level work based on my friends from New College's experiences doing that. So my understanding in public health is that there's not a ton of PhD programs. There are some, but not a lot. There's DRPHs, which are shorter programs that are more like an MPH program in that they're pretty practically based. They're less theoretical than a PhD would be. And that there's not a lot of funding for those programs. So you're paying out of pocket for a DRPH, which is insane to me. I just can't wrap my head around paying for 4 years out of pocket for a DRPH. However, people with DRPHs do often end up going into more of the public health type careers that we've been talking about. On the flip side, a PhD, not in my personal experience, but in watching my friends get PhDs, they're all professors, work in academia, work in research. That's it. That's what they're doing. So public health research is very different from biology research. You're not in a lab. You could be in a lab, I guess, if you were working on Ebola stuff and, growing viruses. And I don't know, if you go epidemiology, you could go that route, I guess. So it is a lot of field work, closer to like what, anthropology field work would look like. But you would be in an academic setting, which has a lot of limitations itself. It's a very particular culture, very difficult market to crack, like to get a job as a professor. I have a friend who was a math student at New College, went right into a PhD program. She graduated in 6 years, which is great for a math program. She applied for 100 professorships and got one offer. So, and public health is a smaller field than math. So this is not to try to dissuade you out of getting a PhD or a DRPH, but those were some of the things I took into consideration when I decided to get a master's degree versus going that route. The other thing to consider is that a lot of DRPHs and PhDs in public health won't accept you unless you have an MPH. So you have to get the MPH first and then go for like 3 to 4 more years of education after that. So yeah, and I was because I was like, I'll just get a PhD. All my friends got their PhDs paid for. I'm going to do that too, free ride. It'll be great. I couldn't swing it. 1, because I needed a master's, and 2, because they're really academic, really academically minded, and I was not interested in an academic career. So just things to consider. I mean, it could still be the right fit for you. There's also potentially, PhD programs that are kind of public health adjacent that might be interesting to you, that could kind of get you to the same place that maybe would provide you with funding. Trying to think of what those would be.
When you were looking at programs, did you ever look at PhD programs that were in like adjacent fields that you had a concurrent MPH program? Because I've looked into clinical psych work, and those programs have MPH programs built into their PhD. Did you look at those at all, or have you seen any?
So I didn't look into any, but I know there's JD MPH, so law school and MPH. There's MD MPH, so med school and MPH, which if you want to go to med school, I highly recommend that, because you don't learn anything about the healthcare system in med school, and that's all you learn about in public health school, and you'll be a much better doctor for knowing that kind of stuff. Let's see, MD MPH, law school, med school, MBA, MPH, so business school and MPH. Those are the ones I can think of off the top of my head, but it would make sense that clinical psych would have an MPH option also. I wouldn't be surprised if there's, like nursing and MPHs, anything clinical. I bet you can find at least one program in the country that'll also do an MPH, which if you're interested in serving low-income populations, if you're interested in the social justice aspect of it, looking for those MPH programs would be, I think, really helpful for you in kind of carving out the path that you want to take.
When you were in your program, did you have much formal education with like grant writing, or how grants operate in the nonprofit world, or did you have to discover that when you were like in your career?
So there's a grant writing class that was offered. It was offered every other year in my program, which is stupid. I don't know why it wasn't offered every year. But what I subsequently learned, and I didn't end up taking it, what I subsequently learned was that a lot of grant writing was kind of the writing assignments from 2 of my first year classes. Okay. But they just never explicitly told us, like, this is how you write a grant. It was just like, here's some stupid writing assignments for you to do. And like, having come from New College, I was like, I can like sleep and write this at the same time. You guys are not even challenging me. So once I learned that, I was like, okay, I think like the grant thing, the grant writing thing is kind of, it is not an easy thing, but it is not as complex a task as I thought it was. Like, I thought grant writing was like this massive undertaking, and it is, because it involves a lot of people at a nonprofit, but it's not as like intricate as I thought it was, mostly because I didn't know what it was. But I've mostly learned on the job about how grants function. And really what I've learned is that every funder is so different that like no one grant is the same. And you're kind of just working with your funder to do what they want you to do so that you can get your money from them.
Other questions? Teagan, if someone wants to explore this avenue further, do you recommend any websites for learning about the different careers that you could have, or any just helpful sort of resources for looking deeper?
So I would start with the American Public Health Association. I think it's apha.org. Look at what they have. They have a list of their accredited schools. I think that the APHA, I think it's called CEF. I don't know what CEF stands for anymore. The CEF accredited schools are the way to go. They use a pretty standardized curriculum for the first year, which is really helpful because it means that you know stuff that other people with MPHs know.
What's spell CEF? CEF accredited?
CEPH.
Ah, okay.
Maybe it might be like Council of Education and Public Health, something like that. So yeah, I would start with APHA. Since you guys have journal access, I would definitely look at the Journal of the American Public Health Association and see what's getting published in the field, see what the field is talking about. And that'll give you a great idea. You know, everybody who wrote those articles are researchers, but it will give you a really good understanding of the scope of what public health actually means. There's also a website, I think it's called thisispublichealth.com, which might be part of APHA, but it's kind of like this movement within public health. They have all these little stickers that says this is public health, and you're supposed to like stick them on things. So like stick them on a water fountain, like having clean water, that's public health. You know, having safe roads to drive on, that's public health. But, you know, the kind of like just general awareness building that could be helpful in framing what, you know, what you think about when you think of public health. That's all I can think of now, but I'm happy to send some links as I think of them, once I think of them.
Teagan, do you have, or are you willing to share your email, just in case if we have any, like, if we want to connect more, if we have any other questions?
Yeah, absolutely. So my email is tkuruna@gmail.com. So yeah, you can email me whenever you want to talk about stuff. You know, if there's something in particular that you're really interested in and I know somebody who knows more about it, like I can connect you with them, you know, because I have only a limited set of experiences, and I wouldn't want to lead you astray.
Thank you.
Yeah, you're welcome.
Anybody?
Anything else? Can I ask you guys a question first before I go? What year are you guys, and like what are you thinking of? Are you just like generally interested in, it sounds like a couple of you have started looking at programs, but like what is your kind of like where are you at in the process of thinking about public health?
I'm the fourth year chem/bio ASC, so I'm not sure yet if I want to go the like clinical route or the public health route.
Cool.
I'm a fourth year as well, and I took a public health class last semester with Sarah and Ed Line, and I just found it to be really interesting, and so I'm interested in looking more into it. I haven't really gone.
So you guys have a public health class now?
There's one like cycles through every now and then, offered by an
Interesting.
athlete who's a local doctor.
Oh, very cool. That's really cool. Where does that doctor work?
She has a private practice, and she also does rounds at a TBI institute in Sarasota.
Very cool.
And she's all over the place. Like, she does everything. And so she's a really great resource for students in public health work.
That's great.
Do you know her name?
Yeah, it's Dr. Lisa Merritt. And she, I took this course in 2014, so it's been a little bit since I have taken it. But she, I assume, still makes you guys look at internships and stuff. Right? And she has a lot of connections in Sarasota, so she's really
That's great.
about public health disparities, and so like she really puts it all out for people to know all these different ways that they can get involved. So,
That's great.
I guess I'm a third year. I'm interested in public health. I'm also not really sure if I want to be a clinician or in a different capacity be involved in public health work. I've kind of looked into industrial organizational psych more and how I could apply that to nonprofit work and help run better and have, more efficient programs in place and stuff like that. So I'm kind of not sure exactly how I'll be in public health, pretty much for sure.
Hello, person I didn't know was sitting there.
I'm a second year biology student and looking into potential careers, and I've been interested in health and especially epidemiology for a long time now.
Very cool.
I am a fourth year, and I have always been interested in health. But my interest really sparked when I started an internship at the Department of Health in Sarasota, where I worked on various projects, and that just really captured me and captivated me to go into public health. Like I said earlier, I'm looking into health policy and maternal child health, and I'm also looking at a couple of programs. So yeah, public health has been with me for a really long time.
Yeah. Yeah, working at the health department is a great way to understand what public health is. They're kind of the engines of like on the ground public health in the US. Yeah. So good job.
Hi, I'm a first year, and I'm a biochem person, and I'm just exploring the options out there.
Cool. That's great.
I'm a second year, and I'm a psychology AOC. I'm thinking social work, but I don't know. Like, yeah.
You have so much time.
Yeah.
You really do. Yeah, I think that's probably actually my last piece of sagely advice is to don't go right into grad school. If you're at all hesitant about what you're going to do, take a couple of years and just try out what you think you want and see if it works. Because for me, it was a complete failure. And I'm so glad. I'm so happy because I would have been 5 years into a very expensive, again, it always comes back to money. But I would have been 5 years into a very expensive program, locked into a job, into a career, into an identity that would have been wrong for me. And, I have watched a number of my friends from New College who went right into PhD programs, drop out, change directions entirely, or make it through their program. They're done. They don't want to do academia. They end up in, doing things that are they're way overeducated for, but they didn't realize that they didn't actually want to be academics. So yeah, I would really take your time because grad school is not going anywhere. And it's going to be expensive in a couple years. It's expensive now. So you'll have plenty of time to pay off the loans regardless of when you start.
Do you know what kind of jobs are available with a bachelor's degree in the field of public health?
Yeah, so my experience has been that there are a number of entry-level jobs in public health. For those of you who are fourth years and are looking for jobs, my organization in particular is hiring a lot of people right now. We're growing a ton, and I imagine that there are other nonprofits around the country that are also growing a lot. But if you're interested at all in any of the kind of work that I described that I'm doing now, you should definitely send me an email, and I'll send you information about the lots and lots of bachelor's level jobs doing all kinds of different things within the organization. So yeah, they are beginner's jobs, so they're not great paying, but like that's, we're all poor for a while. And but if you get in at the right place, you can learn so much, and you can have such a clarity of what you want to do before you invest your time and money in a grad program. So yeah, I would definitely look. Generally, it seems like the code, like the word in the title that you should be looking for is assistant. Like in this sector, for whatever reason, that's the title that equals bachelor's. Sometimes associate, but generally the word associate means master's level.
Good to know.
Good to know.
Yeah.
I want to echo what Teagan said about if you have any hesitation, take a year or 3 off.
Yeah.
Because it won't jeopardize your chances of getting into grad school at all.
It actually, for public health and other kind of practical programs, it actually increases your likelihood of getting in, because they're less interested in people who have just only ever been in school, and they're more interested in people who have had adult life experiences and have seen more of the world. Not that you haven't seen a lot of the world, but you've seen it within the confines of being a student. And so you'll be able to explain a little bit more. You'll have more concrete examples and concrete ideas about why you want to do what you want to do. I took 4 years off in between, and I guarantee you that I was a better student and I'm better at my job now because of it. Just having that time to essentially grow up and like see what the world is actually like, let me see like how broken it is and how much work there is to be done and what I can contribute to making it better.
Awesome.
Thank
Well,
you so much.
Thank
thank you.
you.
Yeah, thanks you guys.
It was a pleasure. Thank you all for coming. And please take it. Teagan is on the alum mentor list, so she's definitely interested.
Come to me. I will talk to you.
Interested, so don't hesitate to reach out if you've all met her. You don't have to go through me at this point. You all can just reach out to her if you'd like. And thank you, Teagan, for giving your time and being here with us.
It was my pleasure. I got a lot from New College, so I want to do what I can to help you guys.
Oh.
Awesome. Do you have a LinkedIn page, Teagan?
I do. You are welcome to connect with me.
Then connect with her. You could also.
Do you guys have LinkedIn?
I do.
Yeah.
Yeah.
Wow, so professional. I'm so impressed.
You can also just see who else she knows and see how an MPH career plays out on LinkedIn as an example for your own page and all that. Cool.
Yeah, you can see my extremely detailed. I went like way overboard when I was looking for jobs with how much detail there is. So you can really see like everything that I've done at every job that I've done. And I'm happy to talk about like any of that stuff with you.
All right.
So can I, if any of you are taking, this is so silly, but if any of you guys are taking a class with Susan Marks right now, or you know her, will you tell her I say hello?
Yeah, I am.
You are? Okay, will you please tell her that I say hi?
Okay.
Okay, thank you. She was my favorite. She was my advisor all 4 years, and I love her.
Do you use Karuna or your maiden name?
Oh yeah, you can. I mean, if you say Teagan, she'll probably know who it is. But my last name when I was there was Keating. Yeah. So, thanks, guys. I really appreciate it.
Awesome.
Bye-bye.
Bye.
Bye.
Thank you so much. And I'm going to end the call.
So you'll be at home.